Hello, my name is Jochen Tunkel and I'm a periodontist and oral surgeon in Bad Oeynhausen in Germany. Perio patients under active therapy. I think it's just a little problem to postpone the appointments for some months. But you have to keep in mind always that, for example, postponing the active treatment for about a year means that 15 to 20% of the pockets going to lose attachment again. So this is quite a lot of attachment loss then in 1 year. Under regular supportive therapy, usually have arrested pockets which cause no damage. And if you stop supportive periodontal therapy, there might be reinfection of the pockets again, and this might lead to active treatment again, and of course to attachment loss. So supportive periodontal is very important. If you're afraid of doing supportive periodontal therapy, especially with sonic or ultrasonic scalar or airflow devices, we can do regular hygiene appointments just with curettes and rubber cups, as we, for example, do all the time with other infectious patients like HIV patients, for example.